Hello, this is Dr. Tembega Buleni, a feminine cosmetic dentist. You must ensure that the instructions that you are given by your dentist after dental procedures, you are really following them. I'm just going to focus on the instructions of teeth removal. What do you do? What are you not supposed to do after removing the teeth? The cotton that you're given to bite on, you need to bite it for a minimum of 20 minutes to prevent the blood from bleeding and bleed to death, obviously. Secondly, is to help to form a blood clot, because as the blood is being stopped in one area, it will gel and form a clot. That makes it easier or quicker for you to heal. The fact that you say don't spit your saliva but swallow it is because people tend to, when they are spitting, they don't just spit what they have in their mouth. They tend to withdraw everything and spit. So in that manner, they withdraw everything from the throat and from the tonsils, and they introduce into the mouth, and they want to spit out. By introducing all those bacteria, it go in the mouth. It can also go to the socket where the tooth was removed, and then you can have an infection. You're finding yourself having a socket that is not healing. Then you have a dry socket. Yeah, and then you have to avoid eating on that side. Obviously, you're gonna dislodge the clot, and you have a dry socket. You'll have this unbearable pain. The pain that you have then is more severe than the toothache itself. Another thing, don't touch there with your tongue or your finger. Don't try to feel how it feels like with your tongue or your finger, or try to show your friend or your lover, like, please check. No, don't do that, because now you are introducing bacteria that are in the tongue or in your finger in the socket, and then you end up having a dry socket. A dry socket is an infection of the socket where the tooth was removed. So don't put your tongue or your finger there. No alcohol, no smoking. The tobacco has nicotine. Nicotine prevents the blood from clotting, so you end up having continuing to bleed because the blood is not clotting because of the nicotine, and the socket not closing because the nicotine is just causing necrosis of the gum area where the tooth was removed. Also avoid eating on that side until you've healed properly. So you do those things. I would normally say for 5 days, because by 5 days obviously the socket would have been closed a bit, and the healing process is starting. So yeah, those are the basic instructions that you follow then to make sure that you heal properly. One thing people normally do is to use the warm salty water. It is good to use warm salty water, but it's how you use it that is a problem. So if you're just going to take the water and then gargle to make sure you clean your mouth and spit, it's fine. But if you're going to put in the water and then suck the clot out, like with the salty water, you're rinsing off the blood clot from the socket with the salty water or the mouth rinse, and you're spitting it out. And then you find that the socket is open, you have a dry socket, you have pain, extreme pain, severe pain. So the way you use the salty water is that you just put it in, you gargle with it, and then move to the side, and spit. Not put it in and with it, because you are sucking out the clot. As much as it's good, yeah, it's how you use it. I hope I've helped you, and if you think this video can help somebody else, please share the video with them, and also subscribe and click on the notification button. Thank you so much. See you in my next video.